Okay, so I'm making this video for several reasons. Basically, I just want to tell you what happened to me over the last year, explain my whole face situation, and, I'm just trying to get this out there because I need help. I cry a lot, so don't mind me. Um, my mouth is wired shut, so it's hard for me to talk. Luckily, today's the last day and I get it open. It's been over 4 weeks now that it's been wired shut. But we'll get into that in a minute. So, I'm trying to get help, because I have been contacting lawyers and nobody seems to want to help me because they tell me it's too expensive to bring a malpractice case, a medical malpractice case against anybody in Mississippi. It's too much money and it's too much time. And there's only a 2-year statute in Mississippi to file a case, and I want some help. Um, I've been turned down. I think I've talked to about 10 to 12 lawyers, and I get turned down, like I said, because they tell me it's too expensive, or, it's not a big enough case, or whatever. And every time they tell me they can't help me, it's really invalidating what had happened to me. And, so I'm just putting this out there, see if anybody can help me. So starting last March, I went to a dentist in D'Iberville, Mississippi, to have some dental work done. I had to have one of my wisdom tooth, my upper right wisdom tooth. I had a cavity. They told me I needed to have it filled, but it was cheaper to pull it. Money's always tight for us because my husband's in the military and I don't work, because I stay home with our kids. So I told him just to pull the tooth. Had I known what was going to happen, I would have paid the extra money to have it filled. So they pulled the tooth. I immediately had severe pain. Over the next 2 weeks, the dentist's office chopped it up to, I had an infection, it's just pain, it'll go away. I couldn't really get them to do anything, so I started looking online, putting my information in about what happened, what I was feeling, all that kind of stuff. And, excuse me just for a sec. And, it said that I might now have TMJ and TMD. A lot of people suffer from that. It's actually pretty common. Mine seemed to be pretty severe though. So I went to a dentist on the economy, paid out of pocket for this person to get special treatment for the TMJ. They confirmed I had TMJ and TMD. TMJ affects the joint in your face. In the jaw, TMD affects the muscles. So, long story, but got treatment, got a little bit of help. There really wasn't a whole lot going on with relief-wise, so I went to go see a doctor on the base at Keesler Medical, who have been wonderful, by the way. I went to go see them. They also confirmed I had TMJ and TMD and sent me for treatment. I got a few injections in my face. I had some ultrasounds, all that kind of stuff. And then a short time later, my jaw locked shut. My jaw was locked shut for 3 weeks before I could get in for surgery. They took me in for surgery. They cleaned out the joint. They opened my mouth. They gave me some Botox to relieve the muscles in my face from spasming. I was okay for a few months after that. But I went to Arizona for about 7 months, 8 months, because my husband was sent to the Middle East and I needed help with my children because the pain was really severe and I needed help. So I went to Arizona, found a specialist there, didn't have any problems with my insurance or anything, and I found a doctor, and they were great. They took me in, did an evaluation, confirmed TMJ, TMD, and started treatment immediately. Over the next 8 months, I received, I would say 75 to 100 injections into my face, my neck, the back of my neck, and then also in my back here, to relieve, their trigger point injections to relieve pain and inflammation, to hopefully calm it. I was also seen by their neurologist, who confirmed I had permanent nerve damage in my face, which was causing my headaches and blurry vision and pain down my neck. They did what they could for me, to relieve pain. Surgery for this kind of, injury is really, aggressive, and it's not always successful, so, you really have to do everything before that you can. Um, so I did all that. At one point, my jaw did lock shut again, but they were able to get it open within a few days. I had several blood injections into my face as well. There's a whole different science behind that. Basically, they draw your blood, they inject it back into your face. Hopefully, it'll help. I did get relief in between the times I was having the injections. But when the injections would wear off, the pain would come back. I was just lucky to be in Arizona with family. When my husband came back, I'm sorry. When my husband came back, he came and got us in Arizona, and we came back to Mississippi. And I went back and I saw my doctors on the base again here, explaining to them I was still having pretty severe pain and it really wasn't manageable. So they opted to do another minor surgery to see if it would help with the inflammation and that. So I had that done in April of this year. A couple weeks later, there was no significant change in my pain. So we decided to opt with the bigger surgery, the more aggressive surgery, which I had on May 13th, 2016, and it's where they go in. They essentially are breaking your jaw. They go in, they break the jawbone. They kind of reset it to allow space up in the joint, to allow more motion. My jaw has been wired shut for a month, but today's the day that I get it open. I'm excited to eat. I haven't been eating, obviously. Just drinking milk and stuff like that, naked juices, and a lot of my hair is falling out, so I cut it all off yesterday. Hopefully, recovery will be better with this surgery, but the reason I'm trying to find help is because I'm worried that this is a permanent injury, because I have been told it's definitely possible. If my husband ever decides to get out of the military, it's possible we won't have insurance enough to cover treatment for the rest of my life with this. Surgeries, whatever. And I'm just trying to get somebody to help me, secure financially for my family, for myself, for the future, to make sure I could get treatment if I need it. I'm sure I left out some stuff. I know this is really long and I'm so sorry. But I just want to put this out there. If you know anyone who can help me, please contact me. Thank you.